Good day, I'm Dr. Melissa Mays, and today I'm going to go over how to correctly complete your nursing health forms. It is very imperative that you go through your forms completely before you submit them to ESS and make sure that they are submitted as we're going to go over today. If your forms are not submitted correctly, or if they're not submitted on time, then you will not be allowed to progress in the nursing program, which means you will fail the course and you are out of the nursing program. For the spring 2021 admits, your deadline is January the 4th. So your health forms must look like this example here in ESS, and it must say complete on all items. Now, I realize there's probably a handful of you guys that will have to take CPR. It is imperative that you take CPR as quickly as possible. We will be starting clinical early in the semester, and you will have to be American healthcare provider certified with CPR as BLS provider from the American Heart Association in order to go to clinical. So it's imperative that your report look exactly like this one on the screen, and all of these items starting with CPR down to the health physical form say complete by the deadline of January the 4th. I highly encourage you to get those started today, because what's going to happen is you're going to think your forms are submitted correctly, that they're completed correctly, and there's going to be something wrong with them. So then you're going to have to get that problem solved. You're going to have to re-upload into ESS, and then it takes ESS sometimes a week or more to actually go in and review your forms. So it is imperative, I would say, for the spring 2021 admits that you have all of this uploaded and that everything is marked complete by ESS no later than Christmas, or you're probably not going to meet your deadline of January the 4th. This is the first page of your health form packet. As you can see at the top, you're going to go ahead and complete your last name, your first name, your middle name. You're going to put your phone number up there and your address. And then your healthcare provider, which must either be a medical doctor, a doctor of osteopathy, a physician's assistant, or a certified registered nurse practitioner, must complete the rest of this physical form. And every item on this form has to be addressed. You see the examples that I have given you here on the screen. Every item must be addressed or the form is not completed correctly. And at the bottom it says medical rating for health science student suitability. Your rating needs to be an A, which means suitable for any nursing or health science task. Any of these other items would need justification. You can't be, it can't be C, it can't be light work. That's not going to be acceptable to remain in the program. And if there are any corrections needed, then that's going to be up to the health science department to approve if that's acceptable or not. Your healthcare provider must print their first and last name and include their credentials afterwards, just like you see here where I have Sally Jones, CRNP. And then on the next line, they must have their signature, first name, last name. It must be legible, and their credentials, and then the date that they've signed it. On page 2 of the health form, you must have your first and last name at the top where it says student name. You must include your student number, which in our 1ACCS system is your A number. So if you don't know that, you're going to have to look it up and put it on your form. In the highlighted areas at the top, you're going to see it says must have proper documentation of all required immunizations by noted deadline, or you will not be allowed to attend clinical and will not be able to progress in the nursing program. So you have to have supporting documentation along with this page where your healthcare provider has included the dates. You have to have supporting documentation that you've actually had these immunizations. If any vaccination or titer dates are added to this page after the date that the healthcare provider originally signed it, you must have the administering healthcare provider sign and credential the additions that were added. So that's really important. If ESS sends this form back to you and says, hey, you have to get this further documentation, and that healthcare provider adds that documentation past the original date that the form was signed, then they have to sign it with their credentials, their name and their credentials, and the date that they're adding the additional information. So let's talk about the first immunization. The first one we're going to talk about is hepatitis B. And as you see by hepatitis B, it says that you have to have documented evidence of 3 hepatitis B vaccinations or a titer that shows that you are immune. So I've given you examples here on the screen where it says vaccinations. It says 1, 2, and 3. You see the dates have been completed. You've got the first one on January the 2nd of 2019. And then 28 days later, which is the CDC protocol, you've had the second one, which was January the 30th, or this patient's had the second one, January the 30th of 2019. And then 6 months after the first immunization, this patient received their third immunization, which was July 2nd of 2019. Of course, your dates will vary depending on when you actually got yours. So if you have all 3 of those documented, then you're fine. If you don't have all 3 documented, then you have some options. You will need to get a titer drawn, and it will have to show that you're immune. If you get a titer drawn and it shows you're immune, then you're fine. If all 3 are not documented, then you have to complete your series for Hep B. And to start the nursing program, you only have to complete the first Hep B vaccination, and then as you're in the program, as the dates come up, you'll get number 2 and number 3. If you get a titer drawn, and this is for any of these immunizations, if you get a titer drawn and it says equivocal or negative, that means you're not immune. So then you must repeat the vaccination series. So again, any titer that says equivocal or negative, that means you're not immune, and you must repeat the vaccination series. I want to remind you also, if you plan to get titers, titers are not things that come back overnight. In many cases, it can take a week or plus just to get the titer back. So keep in mind, you're waiting on the titer for a week, and then you're waiting on ESS possibly a week or more to review your form and okay it. This is a lengthy process. Do not wait. Get this process started today, which is the day of your nursing orientation. Okay, now we're moving on to your varicella, which is known as your chickenpox immunization. You must have evidence of getting 2 varicella vaccinations or evidence of varicella immunity, which would be done by drawing a varicella IgG titer. And that titer must come back immune. If it comes back equivocal or negative, then you have to start the varicella series. Typically, you get the first vaccination, and then 28 days later, you get the second vaccination. At the bottom of this form, as with the previous form, you must have the printed healthcare provider first and last name, and you must have their credentials. So you see Sally Jones, CRNP, and then at the bottom she has signed her signature with Sally Jones, CRNP, and dated the form. Any of those items are missing, and this form will be returned to you by ESS to get correctly completed, which will slow the completion process and possibly impede your ability to stay in the nursing program. Moving on to page 3. Again, your name, first and last, should be at the top along with your student number, which is your A number. MMR stands for measles, mumps, and rubella. You have to have at least 2 of those vaccinations or a positive titer in order for this to be acceptable. Typically, you'll get the first one, and then 28 days later, you'll get the second one. Now, this is adult dosing. If you got it as a pediatric or as a child, you'll probably show 3 doses, and that'll be fine. But adult dosing, you at least need 2 that are 28 days apart. If you have had these vaccinations, but maybe they weren't in the proper sequence, and ESS says, hey, these weren't in the proper sequence, they're probably going to ask you to get a titer. And if the titer says that you're not immune, like on the example I'll give you, this person's rubella titer was not immune, so they would have to go get an MMR booster, which is what you see here, where they got their booster on May the 2nd of 2019. All right, tetanus, diphtheria, and pertussis, that is Tdap. You must have a Tdap, not a TD, not a DTaP. You must have a Tdap vaccination within the last 10 years. Those vaccinations are good for 10 years, and it must be a Tdap. No other option, only a Tdap. And so the healthcare provider will date the date that you got the Tdap, and you will provide your other documentation showing where you got your Tdap. This form, the same as the previous forms, the healthcare provider's printed name and credentials. And credentials, I keep saying that, but that's something that is often left off, and then the student has to go back and get this form redone. And again, that's a delay in your completion time for the form. So printed name and credentials, and then signature with credentials, and then the date that the form was completed. All right, page 4. Again, make sure your first and last name's at the top along with your A number. And these health care forms are done on admission to the program, and then some of these items have to be repeated at specific sequences in the program. We're only going to focus on the admission required information at this point. So at admission, you have to complete a 2, guys, that's number 2, 2-step TB skin test. So that means you get two separate tests, not just one, but 2 separate TB skin tests that have to be at least 1 week apart, but no greater than 3 weeks apart. So no greater than 3 weeks apart, preferably 1 week apart. You can also choose to have your blood test done to prove that you don't have TB. You can get a quantiferon gold TB blood test or a T-spot blood test and include those results in your packet. And as long as they show that you do not have active TB, those blood tests are sufficient, and then you don't have to get the 2 TB skin tests. But if you choose to get the skin test, which goes under the skin in your forearm, you have to get 2 separate tests at least a week apart, but no more than 3 weeks apart. So the first TB skin test, you see it says date placed, and this particular one says November the 2nd of 2020. And then you'll have the date read. It can only be read between 48 and 72 hours after it's placed. It can't be read any earlier than 48 hours. It can't be read any later than 72 hours. If you wait later than 72 hours, then you're going to have to repeat the test, which means you start the whole 2-step over again. And again, that would delay you completing and possibly impede you completing by the deadline. So this patient had their first TB skin test placed on November 2nd, and they had it read on November the 5th, which is 72 hours after it was placed. You see the results say that it was 0 millimeters. So it was negative, which is what we want to see. You have to have the person that read the results, printed name and credentials. As you see, Sally Jones, CRNP, and then their signature with their credentials, Sally Jones, CRNP. And then the date that it was read, of course, was November the 5th. Now, they had their first test on November 2nd. At least 1 week, but no greater than 3 weeks later, you're going to get a second TB skin test. I can't say this enough. These are 2 separate TB skin tests that you must get. So the second test was done on November the 10th, which is 8 days after the first one, which meets the requirements. So 8 days after the first one on November the 10th, they got this second TB skin test. That TB skin test had to be read within 48 hours, no sooner than 48 hours, okay, but no more than 72 hours after it was placed. This patient's was read on November the 12th, which was 48 hours after it was placed, so it's acceptable. The results are noted 1 millimeter, which is acceptable. And the results were read by Nancy Sue RN, and she printed her name and left her credentials. And then she signed her name, Nancy Sue RN, and she dated the date that she read it, which was November the 12th, 2020. Now, if you choose to get the blood test, that last box down there says quantiferon gold blood test or T-spot blood test. So this is where those results would be to show that if you are positive or negative for TB. Of course, you want to be negative for TB, because if you had TB, then that would be a problem with, if you had active TB, that would be a problem with coming into the nursing program. Again, I want to reiterate, if you choose the skin test, those are 2 separate tests done at least 7 days apart. All right, page 5. Page 5 starts out with your influenza vaccination record, waiver, or declination. Now, the influenza vaccine is required by our healthcare facilities. All of these items are required by our healthcare facilities. That's why you can't go into clinical without them. So when you get your flu vaccine, which you will have to start the program, you have to have a current 2020-2021 flu vaccination for you to be able to start this program. Then where it says record of immunization, you're going to see the student name. Put your name there. This one happens to be Jane Doe. The date it was administered was 11/2/2020. The facility where they received it was the Ouch Urgent Care in Tupelo, Mississippi. The date it was, or the site it was administered in was the Wright Deltoid. Seqirus was the manufacturer, and then the lot number is there, and the expiration date is there. Y'all, you have to have that. That has to be included in your vaccination record because our healthcare facilities require it. You have to have the manufacturer, lot number, and expiration date. And then the last part of that is the signature of the administering healthcare provider. So Nancy Sue RN signed that she gave this vaccination to Jane Doe, the student. There's questions down here that says, have you ever had a severe life-threatening allergic reaction to any component of the vaccine, including egg protein or to a previous influenza vaccination? You're either going to answer that yes or no based on your history. This particular patient said no. Do you have a history of allergy to eggs? If yes, please consult with your physician before receiving the vaccine. This patient said no. Have you had a history of Guillain-Barré syndrome, which is a severe paralysis that has occurred within 6 weeks of receipt of a prior vaccine? If yes, consult your physician before receiving this vaccine. And do you have any other medical reasons? This particular patient had an answer to no to all of those. Again, your physician will decide if it's safe for you to take this vaccination. Just know that if you are not eligible to receive the vaccine because of a documented health problem, then this waiver can be signed. But the requirement by the healthcare facilities, if they allow you in, and they have the right to deny you entry into clinical if you don't take the flu vaccine, if they allow you in without the flu vaccine because of a medical reason, you will be required to wear a mask from the point that you enter their healthcare facility all day while you're there until you exit the healthcare facility. So again, that's up to the healthcare facility if they allow you to enter their facility without having a flu vaccine or not. And typically the college is not going to allow that unless there's a medical documented reason for you not having the flu vaccine. All right, declination may be denied by the clinical facility, as I said. It says, I am eligible to receive the influenza vaccine but do not want to take it. I understand that by refusing the vaccine, I may be putting myself, family and patients at risk of getting influenza. I'm aware that hospitalized patients are at increased risk of getting serious complications following influenza infection. I will comply with the clinical agency protocol for those who do not receive the influenza vaccine. I'm declining to receive the flu vaccine based on reasons of conscience, including religious beliefs. So this is saying you don't have a medical reason, but that you're just refusing to take the vaccine. And again, you may or may not be allowed into the clinical, and that is based upon the decision of a clinical agency. The next 3 pages, pages 6, 7, and 8, have to do with what we call essential functions. These are things that you must be able to do or perform in order to be in the nursing program. Your physician or healthcare provider that completes these forms for you will decide, based on their evaluation, if you meet these essential functions or not. So you can read through all of those yourself. I want to point out this last statement on page 8 that I've highlighted, and it says the above statement of criteria is not intended as a complete listing of practice behaviors, but as a sampling of the types of abilities needed by the student to meet program objectives and requirements. So again, your healthcare provider will determine if you meet these requirements, and you will also sign determining that you meet these requirements. The very last page of the packet is page 9. Again, make sure your name is at the top of that page. And your healthcare provider, again, it has to be a medical doctor, a doctor of osteopathy, a physician's assistant, or a certified registered nurse practitioner must complete this form for you. And it says, I certify that the above named individual, and you see that they've checked, is able to perform the stated motor and sensory essential functions. So then they're going to have their signature and their credentials. It's really important that you check before you walk out of their offices to make sure that everything is properly signed with credentials on it and dated. So the date on this one is 10/26/20. They printed their name, Sally Jones, with the address of their facility and their phone number in case there needs to be any contact with them. And then this last part of this page, you're going to be completing. It says, I have reviewed the essential functions for this program, and I certify that to the best of my knowledge, I have the ability to perform these functions. I understand that a further evaluation of my ability to perform these functions may be required and conducted by the health science program faculty if deemed necessary to evaluate my ability prior to admission to the program or for retention and progression through the program. So signature, Jane Doe signed it, then Jane Doe printed her name. She dated it 10/26/20. She gave her address. She lives in the city of nursing. She gave her phone number. She gave her zip code. So again, all of this has to be correctly completed by the healthcare provider and you prior to submitting to ESS. This is just a reminder of what your profile should look like by January the 4th for the spring 2021 admissions. Everything on here should say complete by it, starting with CPR down to health physical. As I said, I understand that some of you may be taking CPR your first semester. That has to be taken very, very early for you to get it back in time to go to clinical. So if you have a way to take that before the semester starts, I highly recommend it. You can go to your local hospital's education department. You can go to a fire station or anyone else that's a certified instructor for the American Heart Association BLS provider. That's the only type of CPR that's allowed in this program. It's American Heart Association BLS provider CPR. And you will have to submit a copy of your certification, your card front and back to ESS. So again, everything from CPR down through the health physical form must say complete by January the 4th in order for you to be placed in a clinical group and progress in the program. If you have any questions, I am the course leader for Nursing 112, which is fundamentals, the first course that you'll take on the Fayette and Pickens campus. Feel free to email me at Melissa, that's MELISSA.MAYS @bscc.edu. Now, I can't overturn any ruling from ESS, but maybe I can answer a question you have about how to complete the form correctly. Thank you for your time, and guys, get on this today. Do not wait.